Okay, so today we're going deep on Parkinson's disease.
Yeah.
You sent over some really cool stuff from the Cleveland Clinic.
Yeah.
Really interesting, and I think we can unpack it all here. So
Yeah.
I know that you already have some familiarity with Parkinson's disease.
A little bit, yeah.
But we're going to go kind of beyond the basics
For sure.
here. So
Yeah.
to start, Parkinson's is a brain disorder. It primarily affects movement and is progressive, meaning those symptoms get worse over time.
Right.
But how does it even begin? Like, what's actually happening in the brain?
So you can almost imagine your brain's movement circuitry like a complex orchestra. And dopamine is like that conductor that makes sure every instrument is playing in sync, in harmony.
Makes sense.
And in Parkinson's, the conductor starts losing control. Specifically, the brain cells that are responsible for producing dopamine begin to die off.
Okay, so then less dopamine equals more movement problems.
Exactly.
And then eventually those movement problems become more pronounced.
Right.
Yeah. You mentioned, though, that tremors aren't always present.
Yeah, that's one of the really interesting things about Parkinson's.
Yeah, so how was Parkinson's even diagnosed early on then?
That is a great question, and it's something that research is really focusing on right now is early diagnosis. One thing that might hold the key is the presence of what are called Lewy bodies.
Okay.
And these are abnormal protein clumps that are found in the brains of people with Parkinson's.
Interesting.
And scientists are looking at if we can detect these even before motor symptoms show up.
Wow.
Imagine the impact that could have on treatment.
Yeah, that would be revolutionary.
Absolutely.
So what might those initial, more subtle symptoms look like?
So it could be something as simple as a slight tremor in one hand.
Okay.
Or maybe you notice your handwriting is getting really small.
Oh, wow.
Some people experience stiffness or slowness in their movements. Imagine trying to button your shirt and it feels like your fingers are moving through molasses. That's the reality for a lot of people with Parkinson's.
That's a really powerful image.
Yeah.
It really makes you realize how much this impacts daily life.
And it's not just about the movement. Imagine struggling with sleep every night or dealing with fatigue constantly or facing unpredictable mood swings. These are all non-motor symptoms that can be just as debilitating as the movement issues.
Wow.
And they often go unrecognized.
That's heartbreaking. So we have this complex interplay of motor and non-motor symptoms, all stemming from this loss of dopamine.
Exactly.
Is there any good news here? What can be done to help people manage this?
So the good news is that while there's no cure for Parkinson's yet, treatment can significantly manage symptoms and improve quality of life.
Okay, that's good.
Medications that boost dopamine levels or mimic its effects are really the mainstay of treatment.
So if the cause of Parkinson's is unknown, how do researchers even begin to look for a cure?
It's a puzzle for sure.
Yeah.
It's complex. But, you know, with advanced imaging techniques, with genetic studies, researchers are able to study the brains of individuals with Parkinson's. They analyze genetic predispositions. And they even explore potential environmental triggers. So it's really about understanding those intricate mechanisms involved in that disease process.
I see. So these medications are basically trying to compensate for that lost dopamine.
Exactly. One way they do this is by acting like a decoy for dopamine receptors. So they essentially trick the brain into thinking there's more dopamine available.
Interesting.
And beyond medication, things like physical therapy, occupational therapy, and speech therapy can help people manage the various symptoms.
So it's really a multi-pronged approach.
Exactly.
Addressing both the physical and mental impacts of Parkinson's.
It's about providing holistic support to improve that overall quality of life for those living with the disease.
This has been incredibly insightful. So for you listening, remember that Parkinson's is a complex, progressive neurological disease. But the key takeaway here is that treatment can make a real difference in managing the symptoms.
Absolutely.
And living a full life.
And given the role of both genetic and environmental factors in Parkinson's, it raises a really important question. What steps can you take to potentially reduce your risk? This could involve things like lifestyle choices, diet, even being mindful of environmental exposures. That's something to think about as you learn more about this disease.
Absolutely. The Cleveland Clinic, where your information comes from, is a fantastic resource.
Great resource.
For further exploration. You can find detailed information on their website, or, of course, talk to your doctor.
Yes. Definitely.
For more personalized advice. Keep those brains buzzing, folks.
Yeah.
We'll catch you on the next deep dive.
Sounds good.
See ya.